Well, that was a reminder to mute my phone, wasn't it? Jennifer, we can get started. Are you recording?
Yes, we are.
Okay, thank you. Well, good afternoon, everyone. Thank you all for joining us for this second session of Engaging Men and Mobilizing Men, Movement Making in New York, Part 2. And this is part of the Prevention Summit that the New York State Coalition Against Domestic Violence holds annually. This is our 6th annual Prevention Summit, and it's always chock full of excellent presenters and panelists and wonderful conversations about innovations and promising practices in prevention across the country and across New York State. And the part 2 of this discussion is really building on part 1 from last week, where Russ Funk, our illustrious consultant on all engaging men matters these days, presented on a not yet published report called State of the Field, which he authored in his role with NAMEN, the North American Men Engaged Network. Now, if you missed part 1, never fear, because Russ will provide a very brief overview of those findings, but we really want to get to the conversation as quickly as possible. If you missed part 1, you can access the recording of that webinar. And Jennifer, I think you can put the link in the chat box for us. That would be great. So we have this wonderful roundtable forum that we've designed today with some really excellent panelists. They will be responding to the report and talking about their own experiences with engaging men efforts in their own community, in their own work, both professionally and personally. And this is just an excellent group of panelists. There are also a lot of participants on this webinar. I looked at the registration. I took a little peek at the registration list. So I know we have a ton of expertise on this webinar, and also not just in engaging men, but in prevention strategies and community organizing in general. So we hope to hear from you today. Jennifer Clark, I'm going to turn it over to her, who will be going over the logistics for how to participate in today's conversation. So Jennifer, take it away.
Thank you, Lorian. Hi, everyone. I'm Jennifer Clark, the Operations Coordinator with NYSCADV. So we do have a few ways to participate in today's webinar. We do know that we do have the chat box available to provide any comments or questions, and those we can read out for you. We do also know that sometimes that is an accessibility issue, so we are also allowing for today for folks to ask any questions or make comments live. The way to indicate that you would like to be unmuted would be to use the raise your hand feature. And once your hand is raised, when we can go through and you'll get a prompt to allow for us to unmute you. And as well, we are offering captioning today to also make today's webinar more accessible. There is a link in the chat box to get to the full transcription. There is also a button in the toolbar below with a CC on it that should pull up the captioning in the bottom of your screen. And with that, I'm going to hand it back to Lorian.
Thank you, Jennifer. So yeah, so if you raised your hand, that's an indication to us that you'd like to be unmuted and you'd like to speak. And if you put it in the chat box, that's an indication to us that you're giving us permission to read your comment or your question aloud, particularly helpful for the people who had to join us by phone and won't have access to the chat box. So lastly, I just want to provide a little bit of context about why we're doing this. So the coalition has been supporting engaging men efforts for, it's really almost 2 decades now, particularly around engaging men to address what we used to call addressing violence against women. And now we're a little bit more gender expansive, and we talk about ending intimate partner violence or gender-based violence. And with that 20 years, we've really run the gamut. We've seen a lot of iterations of the kinds of work that communities really all over New York and all over the country are doing, what they find successful. And, certainly a lesson that we learn over and over again is that something that really works in one community may not really be resonant in another community. So that's why we have this sort of deep bench of panelists to talk today. Now, we embraced engaging men to be a practice early on as a strategy that had a lot of promise. We recognizing that most men do not perpetrate intimate partner violence against their partners. They were not abusive or violent or controlling or coercive, but that the bulk of the domestic violence was perpetrated by men against their female partners and against their male partners. And so that was sort of a recognition that made us feel like this was a strategy that was a no-brainer. And it felt like it felt soundly within the realm of a public health approach. So we want to direct our energy and our funding to stopping the violence from happening in the first place. How do you do that? You address the people who are most likely to be perpetrating that problem, right? And up until that point, we were really trying to get the people who were most vulnerable to the violence to get out of it, not accept it, recognize an abuser, before they became abusive, as if there were a secret decoder ring, I always like to say. And over the years, we've really adjusted our analysis with the help of all of you, domestic violence programs, our partner allies at the state, our partner allies who have a regional bent, partners at the national level, and we've refined our thinking over time. So in terms of engaging men and boys, we really rallied to, in New York at least, with the consensus and agreement of the statewide prevention consortium that we convene, we talked about engaging men and women as allies. And that was the big thing that we thought we would embrace as being more inclusive, that we were all going to be working together. And even that language now is too gendered to really be appropriate. So NYSCADV has a statewide prevention plan that is woefully overdue for an update. And one of our goals in convening you today in this way is to hear from the panelists who will be, again, responding to the NAMN report about the state of the field, but also providing some context about what's happening on the ground in community and things that we need to be taking into consideration as we update that statewide prevention plan, which we see as a blueprint for how we're going to organize our thinking and where we're going to put our energies for 2021 and beyond. So without further ado, I think that I'm going to hand this over to Russ, who's going to be the moderator for this discussion. Please remember, we have panelists who will be speaking, and they have a ton of expertise, and we want to hear from them, but we've allotted 90 minutes for this conversation because we really hope to have a rich, robust conversation with all of you who decided that this was something that you wanted to do this afternoon and to be with us all. So thank you very much, Russ.
Thank you, Lorianne. Thank you, Jennifer. I'm very excited to be here. Again, for those of you who are here on Thursday, just a real brief overview before I kick it off into the panelists. I'm going to start in a minute. I'm going to ask you to introduce yourselves, and then we'll come back and ask the first question. But for the rest of the audience, the North American Men Engaged Network, a member of the Global Men Engaged Alliance, is the network of efforts and activists in Canada and the United States working to engage and mobilize men and boys to promote gender equality. Preventing gender-based violence is one of the efforts that we are a part of, that NAMN engages in, and is probably the primary focus of the vast majority of our members. We are a member network made up of, like I said, practitioners and efforts in the two countries. NAMN engaged in the State of the Field report last spring, realizing largely, let me back up, largely in support, thanks to the support of the Global Men Engaged Alliance, but realizing that in spite of the fact that we've been doing this work in this country for at least 30 years, there's never been a scan in this country and only limited scans in Canada around who's doing what are the trends of our work, what are the lessons that we're learning, what are the approaches that are being used, and that it was time to do something like that, and catch a sense of what's happening. And there was way too much to kind of encapsulate in 2 seconds, but pardon me, some of the key trends that I identified that I think are worth exploring is that across both countries, the primary focus of engaging men efforts appears to be on adolescent and young adult men, adolescent college-age men. There is a strong emphasis on a bystander intervention approach, which comes from, as you all know well, public health theory. And there's a growing conversation around, there is a clear difference between a bystander approach and ally theory. And in engaging men, we kind of merge the two, but those are very distinct conceptual and practice models. And there's some value in both. But there's also a need to really kind of reconstruct ourselves as an allying movement. We have very little intergenerational, in either country, there's very little, if any, intergenerational work that is working with adult men and adolescent men and young boys at the same time in a holistic approach. We have very few efforts that work on structural change. Almost everything we're doing is individual level, bystander intervention, relational level. And then the last one that really struck me is, particularly in this context, that there is both a real desire and a lack of meaningful integration of anti-racist intersectional practice in our engaging men efforts. There's a lot more to it. I encourage you, if you have not, to check out the recording. The plan for NAMN is to use these kinds of conversations to capture more data, to go back to the report and flush it out, and then we will be releasing the report in January or February. And with that, I want to go around with some quick introductions to our panelists. I'm going to come to you in the way that you show up on my screen and ask you for your 2-minute introduction, who you are, where you work, and what your role is. And Rowan, I'm going to start with you. George, you'll be next.
Hi, thank you, Russ. I'm really glad to be here. I'm Rowan Reyes. I use they, them pronouns. I'm a proud non-binary trans social worker. I'm working as a gender liberation consultant, and I've been in the movement to end gender-based violence for a bit over a decade. I think we're at 11 years. So happy to be here. Thank you.
So glad you're here. Thank you. George and Geena, you'll be next.
Hi, I'm George Kilpatrick. I'm the project coordinator for our OVW Office of Violence Against Women, Consolidated Youth and Engaging Men and Boys project. And I do that at Vera House, which is a dual domestic violence agency that prevents, responds, and partners to end domestic violence, sexual assault, and other forms of abuse through counseling, advocacy, shelter, education, and legal support. And I've been there 8 years.
Awesome. Thank you. Glad you're here. Geena, welcome.
Thank you, Russ. Hi, my name is Geena Cruz. I'm the CEO of Hills of Greatness. I'm also the co-founder of the National Father's Day Pledge. We have been doing the Father's Day Pledge now for over 10 years, and nationally for 7 years. It'll be this year. So I'm honored to be here. Thank you very much.
Thank you. Glad you're here. And James.
Hello, everyone. So glad to see you all. Thanks, Russ. So I'm James. I go by he, him, they, them pronouns, and I'm a social sciences professor at Monroe College, a small college in the Bronx. And I also have the enjoyment and pleasure to work for Queery as their program director. We do art prevention work. And in regards to gender justice, I suppose I've been doing this for over a decade as well. So yeah, so I'm super excited to be in this conversation.
Yes, I am so thrilled to have you all be in the same room with you all. This is a kick. I'm giddy. So I'm going to reverse the order. And the first question I have for you is, what surprised you from this report? James, if you can start.
Yeah, thanks. So I love this report. It felt very comprehensive. I realize it's hard to capture everything, and yet I think you said this earlier already, which is there's this desire and interest to move towards intersectionality, and I would like to see more of that. So that's one thing that stuck out. And then the whole athletes, campus-wide efforts to work with athletes, to work with, men in sports. I thought that was interesting, and it's something that I think that we've been doing for a while now, right? And I like to see more of that, and at the same time, be more inclusive of other people. And the other thing that stood out for me was, although queerness was mentioned, LGBTQ was mentioned, it doesn't seem like there's a lot of focus on programs that are in queer communities that's looking at gender justice. So, so that stood out as like something that we want to continue to look at. So thank you for asking.
Thank you. Geena, what surprised you about this report?
I had a lot of surprises, but I'll stick to the couple of them. One was the fact of working both men and the children with youth. One of the things that I've been speaking a lot about is being able to talk to younger kids and their parents, especially their fathers who are trying to do stuff with their children. So that was a big one for me. Being able to be inclusive was another. How we want to continue the systemic racism into the gender equality, I think you called it gender justice, right? And I love that word. So that was another thing that I really, really, truly loved about it, that we're now working on all those areas, especially when we want to try to start reaching the youth as little as, in elementary school. That's one of the biggest things that I really want to start doing here in the community. I've been reaching in the schools, but I see that it's that it's done. And then, like he said, the one thing I did notice, and he already mentioned it, was that the LGBTQ wasn't mentioned as much. So there's a lot of work that still needs to be done with that.
Absolutely. Thank you. George?
I want to just piggyback on what was just said around the lack of anti-racist and intersectional practices. It really wasn't addressed at all. I mean, they talked about culturally informed, but there really wasn't, the report didn't really describe that in any detail. And I think going forward, there needs to be a little bit more focus on that, especially in what we're dealing with in this country today. And I certainly can share a little bit later on about what our agency is doing specifically around the integration of anti-racist intersectional policies and practices, not only within our department, but also within the agency. The other area was the lack of real attention to the faith community. I'm talking about across the board. Our efforts in our agency has been focused on, of recent years, of building what we call an interfaith task force and getting with faith leaders. We call them faith champions. And we use the White Ribbon Campaign, which obviously came out of Canada, as a tool to engage the faith community. But I was surprised to see that wasn't as much of emphasized in this report. And in our work, that includes working across the various faith traditions, not only Judeo-Christian, but also within the Muslim communities as well. And really trying to understand how to reach those different communities in different ways. And that was one of the glaring things. And I also was surprised to see, or not, what I'd like to see going forward, and I guess we'll get to that a little bit later on, which is the integration of practices that include men who have caused harm, if you will, but how are they restored and then used in a prevention focus? And are we as a practice ready to embrace that? Because I also feel that there's there's a distance that we like to keep between people who have been identified that as having caused harm, and how we address that within in our practice.
Awesome, thank you. Rowan, how about you? What surprised you?
Yeah, so I was surprised that despite decades of engaging men work, that there hasn't been an overall review of this kind, that there hasn't been more of that. So this kind of report is long overdue, and I'm glad for it. some of the same things that the other panelists said. I was surprised that there was such a hyper focus on very specific age groups, really leaving out younger boys and men and kids who are masculine of center. And then also anyone above college. We're kind of, I don't know if the thinking is that they're a lost cause. So I was surprised by that. And also maybe this is because I'm most familiar with New York State, that there weren't many statewide efforts, that so many were really concentrated in local regions. So that's something that I think we could benefit from a lot more of that. And like the other panelists said, the ways that the Engaging Men work has kind of siloed itself as a social issue, and seeing it as separate from anti-racist work, as separate from anti-homophobic, anti-transphobic, sexist work, that it's really, and this might be getting into later conversation, but just I think in an effort to make it palatable or understandable, it's oversimplified what the problem is, and therefore I think we can't truly solve it if that's the case.
Thank you. Thank you all so much for that. For those of you who are participating in this, just back to James's first point around the focus on athletes. One of the things that we found from the scan is that there is a general focus overwhelmingly on the two audiences that are most often focused on are athletes or fraternities. Nationally, there are at least 4 national campaigns that focus on engaging athletes. Of course, Mentors in Violence Prevention and Coaching Boys into Men. And I've forgotten the name of the other 2 off the top, I apologize. And one of the questions that emerges out of that for NAMN is, in most communities, athletes and fraternity brothers are the privileged few, right? In a lot of high schools and a lot of college campuses, athletes are overly represented in norms development, norms sustenance in that environment. They're overrepresented in both formal and informal leadership roles. On college campuses, fraternity brothers and athletes are overrepresented in both cases. And so the question that arises for NAMN is, how does privileging the already privileged benefit our work if our work is about challenging privilege? Again, back to this intersectional analysis. And while there's, from a public health perspective, there's real value in focusing on those people who do have a different influence on norms, there's also a cost to that focus. And part of the cost is that those other boys and men who are involved in different kinds of leadership but aren't recognized because they're not in those formal roles. And so that was a really important, I think, point to continue to explore. I have no idea if that applies to New York. This is not a scan of efforts in New York. The whole point of this conversation will be to look at how does what we learned looking at the US and Canada, how does this apply to efforts in New York? So some of you brought this up already, but I want to drill down to the specific question. And Geena, I'm going to be coming to you first. What disturbed you about the report? And both, I'm going to include two kind of sub-questions in that, both about our findings, but also around what disturbed you about the way our process. What disturbed you around how we engaged in collecting this data? Are there questions that we should have asked? Are there points that we should have addressed further? And maybe it's unfair to ask 2 questions at once, but we can unpack it more later. So Geena, what disturbed you about this report?
I would say the first thing that disturbed me is not having at the table people that are affected by this in the first place. So for instance, not having either perpetrators or people who are working in the community, talking to or working with young men on these things, in working towards collaborated efforts towards both men and young men, helping the less fortunate, or not, I shouldn't say less fortunate, but underrepresented. To me, that's very important. I didn't see much about Latinos in the information. So that was kind of disturbing. And again, like George had said, the faith community, the lack of work that has not been done with the faith community, and it not talking about it as well, because there's a lot of work that's being done with the faith community out here in the community and with Latinos as well, you know. And like you just said, you know, perpetrators, I think for me, as a survivor and as a person who has worked in the community over 20 years with gender violence, I believe that perpetrators, you know, can go through the process and be able to get into a program and be taught and learn these ways as well. So I think that's a big thing, having everybody at the table.
Thank you. James, how about you? What disturbed you about this report?
Thanks for asking. You know, I don't want to belabor all the points already made right earlier in looking at intersectionality, looking at queer culture. But I think about like how something that came up over and over again was meeting men or meeting people where they're at. And I totally get that, right? Like, you know, you can't bring people forward unless you see where they're at and then move them forward. But there was a discussion in there a little bit about, but is that also enabling in some way, or is that right? Like, is that problematic in some way? And I think the answer is probably yes for both, right? Like it's a complicated conversation. So I'd love to see that fleshed out a little bit more, and maybe having some conversation that supports the movement and having practices around that. The other thing that stood out for me was, you know, we talked about systemic issues, and one of the things I'm thinking about was funding, and I think the report itself, right, was vulnerable enough and transparent enough to say, hey, you know what, we can only do this because of the funding we got. But then I'm thinking about all the programs that it mentioned, and you know, going back to Surprise, I have to say I am impressed with the amount of work that people have been doing for so long, you know, with so little funding. I mean, so props to all the folks who are doing that. But the question is, I'm wondering if there's a way to find out where that funding's coming from, who's funding, who gets funded, right? Like, is there privilege in that range? And just two more quick points, which is, you know, back to the conversation about athletes, you know, I totally get, you know, MVP, Jackson Katz's work on MVP and all that, and working with athletes. And I think there's something, I don't know if it's the right word, but something alluring about working with athletes who have, yes, they're privileged, and yet they're also the people that set the trends, right, that everyone else is looking out for. So I totally get that. And yet in some ways, aren't we also objectifying them by doing that, right? Aren't we using the same practices? So yeah. So I think it's complex. I do want to give a shout out to SADA. SADA is a program through Rockland. Oh, no, not Rockland. Center for Safety and Change. And they engage young folks, and it's co-ed. Co-ed's not the right. It's for all genders, and it's for high school students, and they engage community members, community program providers to provide some of that training as well, so that it's not just Center for Safety and Change that does the work, but the entire community in Rockland is providing it. And so that creates that intergenerational piece, right, as well. So both not co-ed, all gendered, and many ages of that provides that mentoring, right? That's at a different level. So I'd like to see more of that kind of stuff.
Nice, thank you. Rowan, how about you? What disturbed you about this, the report?
Yeah, I will always say we need more nuance around gender. We need to have queer and trans folks centered. I think in the movements, we often celebrate just even being mentioned at all, being a footnote. And what's disturbing to me is still when we miss the fact that there can be no gender justice without queer and trans folks being centered. particularly Black, Indigenous, and people of color who are queer and trans. So that would be the first thing that is unsurprising, but continues to be disturbing. And that would benefit the work, honestly. Connected to that is the ways that the gender binary and stereotypes about masculinity are reinforced in the ways that we try to engage men. And it's so tricky.
Yes.
Your question, Russ, that you raised, like, how do we mobilize men without centering men? And I see a lot of similarities in the anti-racist movements. Like, how do you get white folks to do better and to confront racism without making it about white folks being centered? It's tricky. And I think the place to begin is listening and centering the voices of those who are most impacted. And I think we could benefit in the movements to engage men, and I usually add, and people who are masculine of center, right? So just that language is acknowledging that we're working with more than women and men. Its gender is a spectrum, and there are folks who are all over that spectrum, and we need to hear from them. And start by acknowledging that. But also the ways that, because we all are have internalized toxic masculinity and sexism, the ways that we, in our efforts to engage men, kind of soften the work, lower the bar because we don't want to lose men, overly celebritize and reward and like uplift men, boys, and folks who are masculine of center for just displaying like the most basic humanity. And I think what we need there is accountability to queer and trans folks, to women and other marginalized genders. And that's where we lose that. We're so excited that they're like involved that we need to be mindful of how that can water down what justice and real change looks like. And my last thing is the overemphasis on the individual and interpersonal. Like, where's the systemic and the structural and the intersectional, and the ways that we reinforce white supremacy in our carceral approaches, the approaches that still uphold the criminal legal systems, which we hopefully at this point everybody is aware of how that's another form of violence. I'll stop there.
Wow, such deep thoughts. Thank you all so much. George, and how about you? What disturbed you from this report?
I'm still trying to process what Rowan just said. Thank you. Laid it down, and wow.
Yeah.
Thank you for that. Really appreciate that. And I think what else to add other than what Rowan articulated for us around, again, this notion of not really being clear about how we interweave the issues of intersectionality and anti-racist policies in this work, not only of engaging men, and I'm going to use that term since that's what this report is, but also the movement in of itself. How do we make sure that we are using the lens of anti-racism and ending white supremacy as part of this work? And so was something that was also missing for me. But also, I think I missed this earlier, just that there isn't much evidence base, which is what, again, back to the funding, that's what they're looking for, that's what they're supporting. And there isn't much, that was surprising to me that we didn't have much of the evidence base to support the work that we're trying to do. The other thing I was thinking about is the practitioners, those of us who actually are doing training versus the people that we're trying to engage, and maybe some work around the work that we continue that need to do to make sure that we're on top of our game and that we are carrying forward the nuances that all of you have spoken, so that we're continuing to do the work that we need to do to make to make sure that we're doing these nuances. I mean, I'll say something about our work really quickly, that
please.
We have what we call our 12-men model, which is a peer group that gets together of men who are male identified, and they are accountable to one another. They learn prevention, gender-based prevention strategies, but we're also then asking them to do something about that. And even in that model, we recognize that we have not included people on the spectrum, on the gender spectrum. We've now started to do this work of creating a group that at this point will be separate from, but centering the experiences of queer and trans folks. So I think this report doesn't do that, but that's the direction that we need to go in.
Awesome. Before I go to the next question, I want to see, because there was so much richness in that answer, I want to see if any of you want to respond to each other or any of the points that were made. And then while y'all are thinking about that, Lorianne and Jennifer, do we have any questions or chat from the participants that we want to bring into the conversation? But before we go there, let's start with our roundtable folks. And do you want to respond to each other yet?
Ooh,
Go, Jay. Go, George.
No, but one of my colleagues just said something that I think is worth pointing out, which is that mandating evidence-based is a way of promoting white supremacy and it's systemic. So even though I said that was missing, that is certainly something to take into consideration. So thank you to my colleague in the chat, Eric McGriff, for bringing that into the conversation, because that was something that I also thought about. How do we acknowledge the more informal ways that gathering in conversation with one another, building community with one another, and that is happening, but because the system says we have to capture that with science, we miss some of the opportunities in the way that people are being engaged. So thank you for that, Eric. Absolutely.
And if I can just bounce off that real quickly, one of the things that emerged for NAMIN in reading this report was kind of related to this evidence-based conversation. One of the ways that we have set up for evidence to be demonstrated is to be published in a peer-reviewed journal, right? But if you look at who is reviewing those peer-reviewed journals, it ain't our peers. It ain't male engagement practitioners. They aren't intersectional. They aren't multiracial. They aren't queer. They are primarily cisgendered white folk in academia who maybe study male engagement work. And I don't mean that as a slam against academics, but studying the work and doing the work are two different things. So one of the takeaways from NAMIN is, and there is value to peer review, right? I want my peers to review my work. I want y'all to give me some feedback. I want y'all to call me out on where I've made mistakes in terms of, I want y'all to do it, not my not peers, right? And so one of the things that NAMIN has already started to do is how do we democratize and decolonize the peer review model and make it more accessible, make it more meaningful, make it something that, George, as you said, and you pointed out from your colleague, how can we capture that we are collecting the evidence that we already have and sharing it amongst each other in a way that advances the movement? And Lorianne, I see you had a point too.
Yeah, I just wanted to weigh in about the evidence piece because I think it's so very much related to the lack of funding for prevention, particularly prevention that is community-based, community-generated, really engages people to decide what is going to prevent all forms of oppression, but particularly the violence that we're talking about today for themselves, rather than having a funder decide and impose, a way of doing things onto a community. And I have to say there is hope. And so, George, to your point about, the funding and James, we've all sort of talked about that there's just a lack of funding, which is why it's on our legislative agenda every year, which is to try to just muster up a little bit of support, whether it's through our state, our legislators, to make the argument that an ounce of prevention is worth the pound of cure, right? And so we could be doing so much with some prevention dollars based on all of the expertise that's around the state and that we've learned for the past 2 decades. But there is hope because we're able now to make the case more and more that we don't need it. There's like 1 or 2 evidence-based prevention programs in the whole country. There's Coaching Boys into Men, which is evidence-based and required millions of dollars. And there's Expect Respect, which is still only evidence-informed if you think about, what they did in order to evaluate the efficacy of that. And they both, of course, are the ones that sort of get picked up as there's evidence, so the funders will pay us to do this, to implement it at home. But even the CDC, which is the main governmental funder for prevention, even now, has really backed off and lightened up. And I'll be very brief about this on the evidence, that we have to have an evidence base and we have to use evidence-based programs, recognizing that just wasn't possible. And so the lightening up of it is really promoting this notion of what's evidence informed and practitioner informed, which is even better. And so there's this sort of matrix of, for me, if I were a grant maker and somebody came to me and said, we believe this works, we have lots of anecdotal evidence, we've followed, I'm thinking about SETA, right? We've followed students, those students, you've nurtured activism in those students, they come back and they want to work, in social justice realms because of what they learned in student activist ending dating abuse settings, which was intersectional and which got them all, activated. That would be enough, that should be enough for a funder to say, yes, I see the value in that. You've got this evidence, let's do another pilot. Let's pour some energy and some money into that. So again, because CDC is considered the sort of the most scientific of all of the funders, if that's something that people need here in this community of participants on this call, we can get you that information so you can make the case with your funders and nudge them along in that direction.
James.
Yeah, so thank you all. You got so many ideas going, so
Yes.
I'm going to speak as my role as a from Queery, the program that I run, the not-for-profit. And so, our work is very, it's a one-shot deal, right? You come and check out the art, you go, ooh, oh, I learned something, and then you walk away, and there's not much more engagement after that. And I bring that up as not something to be proud of, but it's just part of one of the things we do. And one of the things we do with that is that we try to connect with people through social media and have an ongoing relationship. So I don't know if you all have noticed for you, but during the pandemic, I now have friends that I've never met, but I am so friends with and have connected with and have grown and had real conversations. I had a conversation with someone the other day on social media about how he cannot wear pink. And then we unpack that a little bit. That doesn't show up, right, in our query work. As a professor, every semester, every class I teach has something in it about the word girl versus woman. It's every engagement I have with my students for all semester long has that and sparks interest. And I think, these programs that are doing these one-shot deals is really important. At the same time, it's the informal stuff that, right? It's the conversations afterwards. It's the people where we don't collect the information, where we don't provide that evidence. I think that's where some of the change is happening, but it's hard to collect that kind of information. And so I love that we do men engagement, but that engagement is typically temporary. I mean, we don't have like years and years of working with the same people over and over again, unless they're our colleagues, right? And so I think part of that has to do with the informal pieces because we become friends with these people, right? We become colleagues in some way that's not direct. And the other thought I had was about primary prevention versus tertiary, the intervention pieces, right? So, the idea of working with men who have been held accountable, I don't know, for their misdeeds as a toxic masculinity, for abuse, for whatever. That sounds great and all. And at the same time, we're, when we look at something like primary prevention, how do we get the evidence for that, right? How do we prove that we've prevented something? And I guess there are best practices and informed practices, but I think that part of the work, as you all have already stated, is how do we record something like that so that we can write it in the language for the people who give us the money to do it
Yes.
And that's like a whole level of work that seems in itself oppressive. I don't know if that makes sense, but like, right, it's like it's setting us up to do work that distracts us from the work that we're doing already. So I'm just voicing the frustrations I've had over the years, and that my colleagues have had over the years in regards to, well, I spent so much time writing this grant or this report or having to write these numbers and then do the evaluations and then do the statistics for it and blah, 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 when I should be out there doing this, right? Or having these conversations.
Yes. I think, James, you raise a whole lot of the conundrum around, capturing evidence. And one of the things that I think we might be able to learn from the Global South is that there's less focus on evidence-based and more focus on storytelling. And to your point, how do we tell the stories of our success and our progress and make those stories rich and, Rowan, to your point, nuanced enough that they demonstrate that we're making progress. And there's reason to believe in this, but get away from so much of the rigmarole of what we expect in this country of evidence and how do we track that evidence. And one of the other findings that we found in the report is that there is a real desire amongst the practitioners to better capture the evidence, but they aren't supported to do that. They are supported at best to do satisfaction surveys, not really capture evidence. They aren't supported in terms of the funding. They aren't supported in terms of the skills. The methods that we have are by and large are very limited. The methods that we have primarily focus on attitude change or behavior change, not structural change, again, to Rowan's point. And they require a PhD to do it in the way that we're being asked to do it. And to your point again, James, I think that there's so much pressure on us to keep making progress and keep doing the next step that we rarely take the time to catch a breath and go, what are the lessons that we're learning about doing what we're doing? And again, that's one of the other glaring things that to me came out of the report is that we aren't supporting a learning culture amongst male engagement practitioners and activists, because we aren't, and the funders certainly aren't, because the focus is so much make progress, demonstrate change, go on to the next thing. Geena, I think I saw your hand a bit ago that maybe you indicating you might want to say something.
Well, one of the biggest things I would like to say is how do we create change when we continue to do things the same way over and over and over again? If we continue to do it the same way in the workplace or in the community or in every place that we go, then how can we create the change? Okay, there's a lack of funding, and how do we incorporate it where we can even get the funding into the employment? I remember one time bringing Lauren in a couple years ago to do a workplace violence kind of model that was based on our job descriptions on the departments. So maybe working on something like that with engaging men and boys as well, I think is very important. I continue to say over and over again, we can't keep making things seem like every person is the same or every job is the same or every workplace is the same, that we can use one model for everyone. We can't do that because what is going on with me is not the same thing that's going on with Rowan or even with Joe, so we need to be able to focus on being able to capture what's going on in that moment with the person, and being able to bring that forth. And I love what everyone is saying and how they're collaborating everything together. I think this right here should be all packaged up and put into something so we can get a lot more funding. I love what Quentin wasn't able to be here today, but Quentin Wilcox in New York City, having those roundtables with the men all the time. Okay, he's continuously having on sexism, racism, violence, and and if they need to bring children in, he allows them to bring children in as well. We continue to do those kinds of work and look at that kind of work that's being done in all our communities.
Awesome, thank you. And Geena, one of the things that you kind of triggered for me also in terms of this whole conversation on evidence is that requirement so often of, what do they call it, fidelity, program fidelity, which undermines, Geena, your point around the nuance of needing to adjust this program for this community. What I create here in Louisville is not going to work in Manhattan.
Right.
There may be pieces that work. And here's the conundrum. And there are some pieces that are required in terms of fidelity. So one of the things that in my mind I would love to see is well, I'm sorry, there's too many thoughts hitting my head at the same time.
Mine too.
Is how do we encourage folks to share the innovative programs that they're developing, and allow them and encourage them to provide some guidance around, okay, so if you want to take what's wrong with this picture from Louisville, here's the pieces that I need you to keep if you want to call it what's wrong with this picture. And here's what you can adjust, and here's some recommendations to adjust it from Louisville, a southern urban environment, to a more rural environment, or to a suburban environment, or from working with adult men to adjusting this to work with adolescent men. I think there's wisdom in the rooms to do that, to say, here's what we created. This is not the magic bullet. This is not the cure-all. This is not the green dot, pardon me. This is a model. Mm-hmm. And take what you can from this, adjust. Here's the pieces that you can adjust. Here's the pieces that you need to hold firm, right? We don't have, I don't know that exists in the prevention work more broadly, but it does not exist in this region in terms of engaging men work. George, you've unmuted yourself, so.
Yeah, Russ, and I think the question is, and one of the things I noticed also is, what are the best practices, right? And how do we define best practices are across the different communities, and what's a best practice in the community you're in? So, and how does it work across different cultural traditions? What might work over here may not work over here, what might work in Latinx. We have to be really clear about taking what works and being able to, and I don't want to use the word evaluate, but we're not really clear about the best practices that people are sharing, and as peers being able to talk about that. I know one of the things we try to do within our funding group is try to do that. What's happening in the Northeast? What are the things that you're doing that's working? And what are the things that you're doing that's not working, so that we can build from each other? And so I think that's one thing. The other thing I wanted to just point out quickly, I don't know what time we have, but I just wanted to get this in. You know, I talked a lot about having an intersectional lens and doing anti-racist work and ending white supremacy. And I just want to add that it's not easily done, and it's more easily said. And I say that because right now, you can Google it, our agency is really involved in real tension around what that means in terms of funding. You know, we've had high profile people leave our agency because the agency has decided that in its strategic plan, it would do the following: end the white supremacist and racist foundations of our organizations to better serve our community, right? Those words have caused our DA and several others to leave the organization because they objected to those words, right? And so what then does that mean? If we're talking about a report that doesn't address that, we're talking about integrating that into a movement. And then you have people who are saying, well, I'm not ready to have that particular conversation, so I'm going to, and if you don't change that, I'm going to run with it. So thankfully, our organization has stood firm and said, we believe this is the work, and this is the work we have to do. And if we're going to claim to be about gender justice, then we have to include the issue of social justice and ending white supremacy as it shows up in our work, not intentionally, but it does show up. So how do we dismantle it, and how do we integrate that? And I just want to put that in there because, you know, it's just not, oh, we're going to do it, but we're doing it, and there's tension that comes along.
Thank you, George. And I think that's an important piece around this is how do we're going to get pushback. If we start moving towards structural change, you know, funders like across the board, funders like knowledge, attitudes, and behavior change. Funders like the individual level of focus. To George, your point, our board members tend to like, let's not shake this boat too much. And across the globe, on the ground activists are saying, we got to shake the boat. We maybe got to blow up the boat, right? And so there is tension, and we are going to get pushback. And I think one of the things that in this region we need to do a better job doing is how do we support each other as we take the stand we need to take in order to do the work that we feel compelled to do, and manage the pushback. I'm completely off script, but one of the things that came up that I want to just touch on was the silos that have emerged in terms of this work in this region, and we have a bunch. I'm just going to run through them real quickly and then hone in on one particular silo for us to talk about. There, in a lot of places, there is siloing between engaging men to prevent domestic violence versus engaging men to prevent rape, sexual assault versus preventing men to prevent sexual harassment or sexual exploitation. There is silos between engaging men to prevent gender-based violence and engaging men to address sexual and reproductive health and rights and engaging men in responsible fatherhood. There is siloing between engaging men on college campuses and engaging men in communities. One of the things that we found in this report that I found very surprising is that there are college-based efforts for engaging men in communities that have community-based efforts to engage men, and they're not aware of each other. In part because of the funding streams, but for other reasons as well. And to the point that I forgot who made, we silo the men as if there is a firm distinction between the men who are victimized or experience violence, the men who perpetrate violence, and the men who are preventionists. Again, part of this is funding. We all know VOCA is real, and the Violent Victims of Crime Act and their funding requirements. But part of it is also conceptual and theoretical. And one of the things that comes up resoundingly clear for male engagement activists is that the men we're trying to engage are all of the above. They may not have put their partner in the hospital type perpetrator of domestic violence, but they perpetrated in some kind of male dominance, sexism, low-level violence, low-level dominance and control behaviors. We're male human beings who have been raised up in a dynamic of male supremacy. So of course we swallowed the water, and that has come out in our behavior. And yet our efforts, there are completely different efforts that work with men who've been victimized and supporting them. There are efforts that we've discussed around supporting men who perpetrated violence to be accountable. And then there's these third tier efforts of working with men to prevent. And Lorianne, you're jumping on this. And a question for me amongst us is that still a benefit? Does that a benefit, or is there time for us? Is now a time to start re-examining those distinctions and what value that they have? Lorianne, you were the first out of the box, so.
I'm so sorry. I know I just really decided I was going to listen today, but I can't help myself. So those of you who know me, I just wanted to mention, because there's such good, wonderful stuff in the chat box. And I've noticed that nobody's really raised their hand, but they're putting like wonderful, just amazing ideas in the chat box. And so please know that we're listening to that. I'm taking notes. We're going to save the chat. We want to bring us together and stay together forever talking like this. But one of the things and Tyler, it's you who keeps asking, are we going to talk about batterer intervention programs? And I really appreciate that. So Russ, to your point that, is there a distinction, and this is true for, white folks too, who consider themselves allies or aspiring allies. Is there a difference when you walk through the world with privilege between the people who've used male privilege and benefited from male privilege versus people who've used that to coerce and control and maybe even physically abuse their partner? And so the analogy, I always test things out with an analogy around racism. I do want to say there's just this debate raging all over the country and here in New York too about accountability and about the utility of batterer programs. we would need a whole other day to really unpack that and talk about that. But one presenter panelist that I wasn't able to get to join us today is somebody who works with two actually men who work in engaging men in their community in the St. Regis Mohawk Nation up in Akwesasne. And they make no distinction between, they just invite all men in the community, male identified, masculine of center, Rowan, to use your terminology, which I'm definitely going to adopt. And it just doesn't matter if you've used violence against a partner in the past, if you've never used violence. It's a conversation about what it means to be in that community. And it addresses, as so many people are bringing up in the chat, the historical trauma that all Indigenous men are feeling, based on what has happened in their communities across the nation and across the globe, in terms of that kind of trauma, in terms of colonization, in terms of genocide. What does it mean to be male or male identified or masculine of center in that community? And the conversation is about how do we show up? That doesn't mean that there's no accountability. It doesn't mean it's a support group for batterers. They've really found a way to do it. The point I wanted to make is that it's very culturally specific. So that's not going to work everywhere. That's not going to work in every community, nor should it, nor need it. But it's impressive to me that rather than even thinking about, it's not just culturally competent, it's culturally safe. It's culturally responsive based on the needs of that community. And I think that that's something that we could really lift up and learn from.
Thank you. To the rest of the panelists, this question about siloing these different groups of men.
Rowan, you go.
Okay, thank you. Thanks, George. Yeah, I mean, this is another way that I think we need to move away from binaristic thinking in the ways that we want to separate men and boys as good men and bad men. And by what we mean by that is perpetrators. What we mean by that is men who have been caught committing a crime, domestic violence, and there's like this using the carceral lens to define even the fact that we use the term perpetrator as opposed to something else.
Yes.
It's like we silo and then silo. And just understanding the same way that in anti-racist work, we don't have like a program or group for good white people, a program for bad white people, if you are white, I am white, so that means that I am benefiting from and participating in white supremacy, and that's all of us who are living in the U.S. as white today. So all of us need that work, and all of us have to be accountable to those who are impacted by white supremacy and anti-Blackness. So similarly, why are we not doing it when it comes to gender justice work, which again should also be anti-racist, where we're understanding that anyone who is benefiting from male supremacy, misogyny, sexism in this culture, all of them are needed to shift that needle. Everybody has committed harm in some way, even if it's not the most overt. So accountability, less binaristic thinking, and then also saturation as opposed to sprinkling. That this is lifelong internalized cultural, it's I always talk about it as living in pollution or smog. Just by breathing and existing, we're absorbing it. So we need to, it's lifelong work. And as soon as we consider ourselves I'm an ally, it's not, ally isn't a noun, it's a practice, it's an ongoing practice. As soon as I think I've achieved it, I'm one of the good ones now, I'm about to commit some harm. So all
Yep.
of that, I think we could benefit so much from really listening and paying attention to the incredible anti-racist work that's happening in this country
Yep.
right now.
And I wanted to just follow up with what Rowan said around how we silo the men who caused harm and who haven't. And in our community, that distinction is through the courts, right? The courts say who is and who isn't. But in program, when you're in the room and you admit to having caused harm, we don't distinguish you or shame you or judge you in that conversation. So in our program right now, that would have been one of the recommendations that I have for the practice going forward, is how we bridge those conversations. At least in our program, we're talking about it because it's engaging men. And, you know, one group is over there and one group is over here, and they're not talking to each other, and they're not having conversations with each other. So in our program in particular, we're moving forward. The person who runs our, quote, batterers intervention program, and me as a prevention program for the engaging men, we're talking and we're looking at how we come together to have a more comprehensive engaging men effort.
Nice.
And
Nice.
that's what I think the practice needs as far as New York going forward, more of that. And
thank you, George. And I just want to, I know we have a hand up, and I want to get to that, but I also, since it seems relevant to this conversation, I want to call our attention to how this good bad binary is relevant to the recent election. And we want a bad guy, Donald Trump, to the cows come home, and we want a good guy, Joe Biden. And all kudos to Joe Biden. He's been our champion. But you know what? A kinder, gentler patriarch is still a patriarch. A kinder, gentler patriarchy is still a patriarchy. And just because we have a kinder, gentler person, Lord knows he's kinder and gentler than the previous president or the current president, whatever you want to call it. But if he's running if he's still managing a political economic system that is built on white male supremacy, it's still built on white male supremacy, and the structure isn't going to change. And so I think I would like to see us bring the same conversation that we're having right now about this false binary to Rowan's point. How does that inform our political conversation as we start planning for the next 4 years and moving forward with this context? Lorianne, do you want to bring the question that was been raised, the raised hand to the conversation?
Yes, Jennifer, I think you need to unmute. Tyler's had his hand raised, their hand raised, sorry. I think that's the only hand right now, but Tyler, Jennifer's going to unmute you so you can, there you go.
Hi. Also, Jennifer, I met you at a drag show in Troy, and I just wanted to say thanks for reminding me to sign up for the newsletter, because that's why I'm here. So thanks. Yeah, no, every time I have gone to a webinar about men, like going to other men about this issue, I always get shut down and told that intervention, like they haven't even thought about it. And I'm just like, well, why? Why are you just focusing on those that essentially, when you look to them, are the ones that you've hurt? You know, like, why are we profiting off of victims' experiences without doing the actual work on the other side? And I know that sounds harsh, but like, that's kind of what ends up happening. As someone myself who has experienced assault and domestic violence, it's just like, I confronted my rapist this year, and even that was healing and was, in a sense, better intervention, because he told me about the work he did and asked me what he thought like he should do in the future. And maybe that like puts it back on me, but at the same time, it was empowering to have done all the research I have, the work on my own part, and to point him in a direction that would have him heal. So these are important things. I mentioned plugging the boat that's still sinking, and that's like the thing that comes up in social work all the time. It's like, we're putting corks in a dam that's still going to burst. Like, it doesn't go away. And this is with so many social welfare issues. You know, I mentioned in the chat about being in an organization headed by a white cishet CEO, man, you know, and it's like, they want to do this social justice like coming together after George Floyd's death. And I'm like, okay, but do you realize what role you are coming out saying this as? Like, did you watch the speech Lyndon B. Johnson gave at a college that was primarily African American? Like, and think about how like those people in the audience felt, like, because there's a lot behind that when it's like you're in that position and you're congratulating people that will never have the privilege you do. Like, why? It's like almost like this sad pat on the back that lacks any true like authenticity of like respecting another individual. And I came out at my agency because one, I'm white, and I'm always going to get looked at as a white woman because it's just going to happen. And two, there's a lot of kids that aren't white and who are questioning their identity and aren't being seen the way that they deserve to be seen. And they also have experienced so much trauma around, you know, their existence and also just existing in the first place. These kids were dropped off at this agency, put into the system because of CPS calls, and then they show up here and they're moved around all the time. And the least we could do is try to understand their perspective in an intersectional sense, and also own our role as white providers, because no one is doing that. And like every person at the agency who is a person of color is like, I haven't been able to attend all the meetings, but from what I'm seeing, it's just like they're just, you know, being quiet, because if they say things like, what if I lose my job? Like, I'm the one getting paid, you know, $13.25 an hour. I'm not the one who has salary. Like, what power do I have in this moment other than the one they are pretending to extend to me? Because it doesn't feel authentic with the history that extends way back of not being supported, not being seen as having a power. So, you know, it's hard for me as a younger person, even though I know I have privilege, to bring those things up. But I also just, if I lose a job, I'm still in college. I can find another job. But for those people, it's like they found a job that doesn't even guarantee them any safety and security. And it just makes me so mad.
Thank
But
you,
I'm
Tyler.
I'm really glad that you guys are having this conversation. And I really would like to continue being a part of focusing on the other side of the issue, and also just bringing it together as one unified process, because it doesn't have to be separated like you were talking about, Russ. It's not good or evil. It's who's in what role at what time. And I think that's the approach we really need to start looking at, because it's, if we separate it like we do with everything, it's not a peanut butter and jelly sandwich, and even that gets put together at the end, right? Like, what can we just know that, like, just like this like relationship triangle theory, where people change roles depending on what situation. Like, you have the power in being the one who's the provider, and then if you're not being told like that your work is valid and great and that you're really affecting someone's life in a good way, they get upset. It's like men who come home after working all day long and they aren't encouraged to take care of themselves. You know, it's like, what happens when they don't know how to emotionally regulate in a healthy manner? Like,
Thank
that's
you, Tyler.
one.
I really appreciate your contribution. We've got some other hands to raise, and we have
Awesome.
about 10 minutes left in this
Oh
in our
my
time
goodness.
together. So we need to start moving forward. So I want to get to this raised hand. I also, for the panelists, I want to start thinking around you all. To start, the question I'm going to be coming to you all with is what do you see as the implications for New York's planning of this report and perhaps of this conversation? And to Lorianne's point, I think the conversation today indicates we need more of these. So we'll figure that out. But if there's some like clear ideas that you have, or some themes around moving forward in New York, that would be helpful. So to the raised hand.
There is no other raised hand. There's a lot
Okay.
of good comments. Yes, there's a lot of good
Sorry,
comments.
Lori, and this is Jennifer. We do have one more. We have Eric McGriff.
Oh, thank you. Okay.
And Eric, I hate to be persistent, but if you can, please try and keep your comments brief.
Yeah, thank you. Just want to say hi to y'all. Thanks for being here. What's good, George? GK.
What's up, Eric?
Thank you. Y'all, I'm a self-identified child of prevention. Started working with Vera House when I was in high school. I'm working professionally now. I'm in New York City building a prevention program. So I'm wondering more about what I was saying in the chat box about psychological safety. In this work, I am a workshop nerd. So I can tell you, for example, that when you're having an open dialogue about racism in your institution, it's not going to be the most psychologically safe because someone's worried about their boss in the room or offending someone, or they're shy, or they might be worried about academic language. I can tell you a focus group can be impacted by the identity of the person impacting the focus group, right? These are just a couple examples. So for me as a workshop nerd, I'm always looking for how I can change and create a more inclusive and participatory engagement from a place of cultural humility and humble inquiry to allow the context to come forth, resisting white supremacist models of facilitation where I get to decide if, when, and how others get to participate, to get better bottom-up communication, to and just more authentic feedback. For me, that psychological safety I provide is important. So I'm wondering, have you all done any work around looking at psychological safety in your engagements, in your research, in your evaluation to address epistemic ethnocentrism or anything like that?
So I'm going to thank you for that question. That actually is a huge question in and of itself. I think it deserves. I'm going to offer a quick response. I think it's a. I'd like to suggest we put that in the bike rack. Some call it a parking lot, but parking lots are environmentally disasters. So I'm going to suggest we put that in the bike lot or the bike rack for now, and definitely come back to that. My response is, I think this is a critical conversation. I think it's also important to distinguish between safe space and brave space, and who needs safety and who needs to be brave. Who needs supported to be safe and who needs to be supported to be brave. I don't think when I'm in a room as an old white dude in a heterosexual relationship with young African-American youth that I need safety. I need bravery. I need courage. They're the ones who deserve safety, right? And so I think there's some real important nuance between and value between looking at safety versus bravery and how we create safe space versus brave space in terms of this question that you're raising, Mr. McGriff. And I see we have another question that's been raised. On my chat, there's a something from Q&A.
Yeah.
It's a request for sharing contact information of participants, which we can handle in a follow-up email.
Awesome. All right, so we have 9 minutes in our time left. Lorian has asked for 3 to wrap up. So if I can get maybe 1 minute responses from the panelists about what are some key takeaways that you have taken from this report or now perhaps from this conversation in terms of thinking about the plan that New York has of differently integrating engagement work in the updated prevention plan. What do you want to see New York take away with? And George, let me start with you, if you don't mind. You're muted.
Yeah, I was
okay.
Getting ready just in case. Okay, so here's what I would like to see. Recognition of the more informal ways that we're engaging men that might not have been formally studied or evidence-based. I'd like to see the report look at how, or New York particularly look at how we engage men who have caused harm or who have been identified through a legal system that have caused harm, and how we re-engage them through prevention programming without them being considered pariahs. And I use that term, not my term, but when we try to engage them in the agencies, sometimes they're not welcomed in that way. And then how do we give men a toolkit to help them, the men that we train or engage, how do we give them a toolkit that allows them to be what we want them to be in the situations that they encounter? In our study through Cornell University, that was the thing that popped up a lot. They wanted more tools to be able to be what we would like them to be in this gender justice movement. I hope that helps.
Thank you. Geena, what's your takeaway from this report or this conversation?
Well, one of them was the toolkit for me, and also collaboration. Collaboration is key. Okay, when we're working with in the communities with people, being able to collaborate with all those that are already doing the work, so we don't have to reinvent the wheel, is big key. So if you say, for instance, Russ, you're doing this work, how can I collaborate with you and bring other people that want to do that work to you, and be able to say, look, this, we don't need to reinvent it, it's already done. Okay, because what we do is continue to reinvent stuff and not use the ones that we already have. So that's a big key for me, to be able to collaborate efforts, even if we have to do like as an ambassador for the United States of Women. When I connect with people, I have a list that we do, and we put it in I think it's called, I don't even know what it's called, but it's like a spreadsheet. I forget the name of it. And we all collaborate together, and we have one place where we have all this information. Okay, I don't keep my information. Lauren doesn't keep her information. Russ doesn't keep his information. It all goes into this pool, and then we collaborate with one another and work on issues that are important in the community, which is here. The other thing is we didn't talk about even human trafficking. Human trafficking should be added into this as well. We have an initiative here in Rochester by the great grandson of Frederick Douglass. And he has he's doing amazing work around human trafficking and as well as domestic violence. So I think that'll be a great collaboration as well. Continuing those efforts into being able to collaborate that. The faith-based community, again, George brought it up, and that was one of the biggest things at working at University of Rochester that we wanted to do. So, and we continue to work on, and I know Quentin has a training for it, so it'll be great to do that as well. And finally, unions. Unions is a big key, and no one has mentioned unions, because with unions, we get into the workplace, the homes, and everything. I've gone to Canada and all over the world just to talk about the work of domestic violence, sexual assault in the workplace, and even in our homes through union. So that's a big key for me.
Thank you. Rowan.
Yeah, I think to keep it brief, just three, I mean, it would be a long list, but I'll pick three. One, it has to be intersectional. If it's not intersectional, it's not justice. So just reiterating that point once more, that the efforts to engage men have to center the voices of Black and brown people, Indigenous people, and other people of color, queer and trans people. And if we're not doing that, then we're still allowing people with privilege to drive the thing, and it will never result in equity in that way. The second is ongoing, that saturation piece, that we need to move away from things that are easy to report and look good, but kind of move on to count people and rack it up for grant reports, but really building meaningful relationships with folks so that we can stay with them as they change, even while the forces of internalized male supremacy and sexism and homophobia and transphobia they're still existing in it, but that ongoing work. And then the last is to move away from the individual and interpersonal focus. We have to focus on structural systemic oppression, or we're just going to keep kind of like dropping the bucket if we're going to continue to focus on the micro level.
Awesome. And lastly, James.
First of all, thank you, everyone. I'm learning so much, and I love being with my people. So thank you for all this. It's healing in itself. So some of the things that came out that I'm not going to ditto is the idea that we need more connections, which then leads us to the idea of maybe more shared time, meaning that we can share what we're doing. If we have a venue for that, then we can see what other people are doing and connect with them in that way. Not just like, share social media stuff, but like, this is the work that I'm doing, and on like a conference of, not conference of teaching people what we're doing, but just sharing what we're doing. The other then leads to funding then, right? Like giving people the time to be able to do that and to connect with each other. So funding is important. And then of course, I would want New York State to model what we want. So, Rowan talked about intersectionality, and I know pronouns is not really that big of a thing in regards to the whole picture, and yet it's so important, right? Like, I mean, just to introduce ourselves with pronouns, to ask our participants to put their pronouns. I know it's so concrete and ridiculous, I know, but I think like that's just like small steps that we ourselves can model and do. And I'd like to see more of that in the future.
All right, thank you all so much. I want to reiterate James's enthusiasm around how tremendous this has been. I think for me, this was well beyond what I had even hoped. This was such a good, rich conversation. And Lorianne and Jennifer, to you all at NYSCADV, I hope this gave you, and I trust it gave you really good fodder for your planning for the report. I'm not exactly sure what to say. I'm so full, I'm not exactly articulate anymore, other than just say thank you all so much. Lorianne, if you want to wrap it up for us.
I will. I'm just going to take a minute to say, boy, we went deep, didn't we? We just sort of, we went really deep into white supremacy and a gender race analysis. And it makes sense that we did that because that's the cultural and societal context that we're living in right now. I want to continue these conversations. So if you are not on our prevention listserv and you want to be, please let us know and we will add you. If you would like to be part of the prevention consortium conversations that inform the statewide prevention plan that we are updating, please let us know and we will continue these conversations. And I also, for those of you who might have wanted to talk about strategies and programs, there is another opportunity before the end of the year. We will be convening a learning exchange with to bring prevention educators and other sort of prevention practitioners together to share strategies that they've been using to engage community and other settings that we've talked about today. How are we engaging faith communities? How are we engaging in schools and in workplace settings? And Geena, to your point about unions, how are we doing all of that during pandemic? And what are the strategies that we're using to make sure that we're still organizing and mobilizing people and getting education out there during a time when it's very, very challenging. So stay tuned for that, but you need to be on our mailing list in order to get that information. So please let us know if you're not. And this was just a fantastic conversation. Thank you for all of the wonderful chatter in the chat box, the really insightful questions. To the panelists, thank you so much for everything that you brought to this conversation. We really do need like a whole other day to talk about it. So stay tuned because we will continue to bring everybody together to have this conversation. I am so very grateful for all of you. Thank you to everybody who joined us. This will be recorded. There will be handouts and information. So stay tuned for all of that. Jennifer, anything as we're saying goodbye?
Apologize. Not too many extra things. I am going to include in the follow-up email a contact form for anyone that wants to share their contact information with other attendees. Also, I asked that when we close the window today, there is going to be a brief survey that pops up. So if you could take a moment just to fill that out and let us know your thoughts about today and also anything else that you'd like to see, that would be a great place to do that for us. And I believe that's everything.
Russ, thank you for your excellent facilitation, your moderation today. Thank you to all the panelists. Thank you to all the participants.
Yes, indeed.
Take very good care of yourselves.
Yes, happy Thanksgiving, everybody.
Thanks, everybody.
Thank you, Lorianne, for gathering us together. You're so good at that.
Yes, thank you, Lorianne and Jennifer, for all your work behind the scenes and keeping us in this space, holding the bucket, holding the bubble, as it were.
I know, I want us to talk more, you know, it feels